Okay, so now we start recording. So did anybody watch the video from last week? Because if you miss anything, what's happening is this is a very interesting way to deliver a course, because it's in person. You have people attending remotely. Are you guys up? Are you there?
Yeah.
And then it's recorded at the same time so that people who are in different time zones, because I've had people in different time zones attend, so it's, I don't know, it's very interesting watching yourself. I had no idea my voice was so deep, but anyway. Any questions from last week? What I wanted to do is, it's going to be different in terms of when I teach this particular course. People, there's different faculty that teach this course, and they come from different perspectives. Because I am a social worker, because I've worked in the field of mental health for over 40 years, I come with a very humanistic perspective of things, okay? And that when we are working in the field and working with one person at a time, because I had you look up, Miles Keaney. I'm related. That person, that cross, the first cross that ever was on Paris Street, belongs to my family, right? And that it's a very personal experience when you're actually sitting with someone. And I think everybody can have a body of knowledge. You can be brilliant, but if you can't sit with someone, and if you can't work with them, and you can't help them go from where they are to where they want to be, it doesn't matter. You can have as many letters behind your name. And I used to work with a guy that had, like, honest to God, that had more letters than a paper could allow him to write. And do you think he could not work with a kid for the life of him? So what was the point? Then go do research, and good for you, go do research. But if you're in this field of mental health and addictions, you have to have the ability to sit with someone and to be able to accept them for where they're at. And I come from, in all the work that I've ever done, I come from a strength-based perspective. I'm going to define what that means. And it's not mine. And again, any piece of information that I share with you, I didn't do all this research. I'm just sharing it. That's why there's no one book, because I'm sharing information from a number of different sources. But this is actually from an MSW. Her name is Bonnie Bernard. And the essence of a strength-based approach. And she said to me, the essence of the strengths-based perspective is that you actually believe that everybody, every community, every family, every individual has a fund of knowledge, of capacities and skills, of personal traits and resources that exist within them and around them that are tools to be used in helping people move toward a better quality of life or move in a different direction. It's helping people move toward what they want, what they see as possible in their lives, their visions and dreams. And I think this definition for me underpins all the work that I do. Everything that you're going to hear from me is going to be from this perspective. She also says, the route to me in discovering people's resiliency and their strength is to have them tell their stories. I mean, to really listen to their stories, not force them into a story that you like. They are often tales of failure, but rebounding, triumph, and tragedy. They're well-rounded stories. I might photocopy this for you and then have this, or else write it out and send it to you so that you have an idea of where this is my perspective and this is what I'm going to be sharing with you. And hopefully, honestly, that you bring this perspective to the field. Right, this very human perspective. This really underpins a lot of what I'm going to be doing today, because we're going to be talking about, last week we talked about the definition of concurrent disorders, we talked about stigma, we talked about discrimination. There's another stigma that we didn't talk about, and that's like, I can give the definition, is the self stigma. Is that it's what we say to ourselves and that's the most difficult thing to overcome. I'm so stupid, I'm so dumb, why didn't I do this? And we say these things to ourselves, and we end up judging ourselves probably more harshly than someone else. I'm so weak, why am I doing this? And it's getting over those kinds of, not only your other people you're feeling stigmatized and judged by other people, But my God, we've taken some of those things, especially if we've had critical parents. And we've had people who didn't understand us, and we start believing that negative dialogue that somebody else has kind of put in our own head. So we have our own self-stigma outside of what happened, that we've adopted that belief system. And moving forward, we want to kind of understand, and it's very consistent with the strength-based perspective, how did people get to be the way they are? They weren't born saying, I think I'm going to screw my life up. I think I'm going to become addicted to a substance. I'm going to lose my job. I'm going to lose my partner. They didn't start it this way, right? So what are all these things that are contributing factors? And that's the skill, actually, as someone who's going to be working in the field, is your ability, you as a person, you have no colleagues, you have no classmates, it's you and the person you're sitting with, is your ability to sit with that person and tweak out all that information to find out who they are, what are the variables that contributed to the situation that they find themselves in. What is it? Where's their strengths in the telling of their story? Where are their strengths? Where are their abilities? Because you will hear what they do not, right? Did I tell you about the two girls that took off? I'm teaching this to a couple of different classes. Okay, I'll give you an example of what I'm talking about. Many years ago, I told you I worked at the Sudbury Global Hospital. I worked on the adolescent unit. At that point, this is the 4th floor, and when up on that 4th floor, there was an elevator, but there's also what they call a dumbwaiter. Now, don't forget, this was a TB hospital many years ago. So they had meals that would come up and down on this little tiny elevator that was just good enough almost for food trays. Anyway, we had these two girls on the unit. That was the entire adolescent unit, but these two girls, what they had done is that they had taken off. They had created they had the other kids on the unit start a fight so that all the staff ended up having to go in that direction. They end up getting on the elevator and taking off. Now, when you fill out a missing persons report, for anybody who works in corrections, your corrections, right? You have to fill out a missing persons report for the police. You have to write down their name, their height, their age, the color of their hair, the color of their eyes, what they're wearing, so that when the police go looking for them, they're looking for these people. Okay. Now, these particular girls, what they had done is they had arranged to have a big fight so that we were all distracted. What they had done earlier that morning is taken the change of clothing, thrown it on what they call the dumbwaiter, sent it down to the basement floor. They had privileges called grounds so that they could go out on the ground because they were very trusted individuals. So they stashed their clothes away. They took off, they changed their clothes, they went into a drugstore, bought hair dye, changed the color of their hair. So, because they knew that when the police were coming to look for them, they're going to be looking for someone with blonde hair. They're no longer blonde, and they've got different color clothing on, or different clothing. So, anyway, they ended up being caught a couple of days later. Yeah, I mean, that's not uncommon that they get caught. They come back and they're brought back on the unit, and usually there's this very punitive kind of way of dealing with them. And I remember the first thing I said to them as they were brought back up, I said, "Don't tell me you can't do that." And why did I say that? Don't tell me you can't. I'm not saying, oh, you're going to go to your room and you're going to be consequenced. And why did I say to them, don't tell me you can't do that? Math is which brain? Which side of the brain? It's left brain function, right? Left brain function is planning, sequencing, organizing, and it's like, you little buggers, look what you did. Like, you could get upset with it because that's a lot of paperwork. It was a Friday, something's happening. Yeah. Okay. Something was, it was late. I ended up having to stay late. And you can get very upset with that kind of stuff, but then, or you can change your perspective. And it's like, look at your abilities. You had to think about this, get these other kids organized, you had to plan, you had to arrange to send the stuff down. That's ingenious, right? Another example, and this is your perspective. This is not about the kids. It's all about us as mental health professionals. It's about being able to see things from a strength-based perspective. There was this, that's okay, come on in. I used to work at Cecil Facer. I worked there, I did my placement there when I was in the child youth care program. And then I was hired on for the summer, and then I worked a year casual. But there was this time when we used to have to do room checks all the time, right? For counterband and that kind of stuff. They were really good. You have to admire, you almost were playing cat and mouse with kids all the time. It isn't, if you saw this as them being deceitful and it changes your attitude about them, but it's when you have that kind of admire how smart they were. Anyway, so you're doing the room checks and there's like Bibles everywhere. It's like, what the hell? Like, why are kids and all of a sudden they were going over to chapel all the time and they were bringing back Bibles. Wow. When you look at a Bible and you look at the paper it's on, what about the paper? Has anybody ever opened the Bible? It's very thin. It's perfect rolling paper, right? And it was. So when you would see, you look at the Bible, and they had pulled out all these pieces of paper, and I thought, this is genius. Like, because, I mean, the Bibles are really, who's going to notice a couple of missing papers? And so a lot of it had to do with us being able to see, you could get angry at that, sure, or get ticked off, but that's an option. That's you professionally, how you choose to see things, right? And that dictates your perspective, your lens on the kid's behavior or a person's behavior, adjusts totally how you're going to respond to them. But it's like you little buggers. And then you kind of had to admire it. Like, they're not all that smart either. You could always tell the kid that had all the drugs because the kids would all be over in the main area. Have you ever been to Pacer? In the main dining area, is that these are kids with 10 desserts in front of them. Like, how stupid is that? Don't make it so obvious, right? So anyway, just looking at things and trying to understand things from how informed we are as mental health professionals. When we sit with someone, it's to hear their story. That's why that book by In the Realms of the Hungry Ghost by Gabor Mate, why that book is so important, because it holds many stories. And you see pictures that people give Gabor permission to tell their story. And you'll read other people's lives and what happened to them and how they came to be. Those are the narratives, and that's your job as a mental health professional, to be able to sit with someone who is wounded and having to use substances as a way of coping, to find out, because Gabor says, you don't ask the question why the addiction, you ask why the pain. Right? And this is your skill in sitting with someone. But you have to, it's not just like, you have to have some direction and some order in terms of how you do that and how you complete your assessment. So what I'm going to be, up until 1977, all we ever had was the medical model of looking at people in addictions, which meant there's something wrong with the brain, right? And the only way it would be treated is by medication or by drugs or by surgery. Have you ever heard, did anybody ever see the movie 112 and Cuckoo's Nest? Okay. Well, they would do a frontal lobotomy, right? They would do a surgical procedure that would kind of just deaden someone's kind of responses to anything. When I worked at the Sudbury Hospital, that was a psychiatric unit. They used to do ECT, electroconvulsive therapy, at that point. And so what happened is the psychiatric patients, like the adults, would be brought up to the 5th floor. And they would put electrodes on their head, and it's called shock therapy. And they didn't really know what it did, right? But you would see these people come back down, and they would have tongue depressors because they would bite, this would make them convulse, right? And so they would end up being out of it like for a day or two kind of thing. And the only thing that they knew for sure that it did is it killed short-term memory, not long-term memory, right? And I used to see patients come down after this, and it's like, this is scary. If you ever, I watched it, it's scary. But that was the medical model up until about 1977, when Dr. Engel came up with the idea is that he was a medical doctor, and he said, this is not enough. And so, because what his thought was back then, in 1977, his name is George Engel, is that what it did not include, the medical model that they had didn't include anybody's upbringing, their beliefs, their coping skills, any trauma, any relationships. This man was like eons ahead of his time because he was understanding that we're missing the human dimension, right? We're only looking at, because last week I asked you, what are you? You are a daughter, you are a mother. There's many different dimensions to you. And it's interesting, as we go through the biopsychosocial, cultural, spiritual model, how complex every human being is. And when we sit with them, if we don't learn all these things, we're imposing our perspective and our belief system. And if I'm trying to devise a treatment program and a way of going from where you are to where you want to become, it's not one size fits all. You can have certain ideas about the process, whether it's some integrated therapy or CBT, but it has to be customized to the person and their lived experience, right? So, but how do we gain that information? So this is why we look at the biopsychosocial model, but we have to look at the various elements that are involved in the biological component, right? So when we look at that, I want to make sure I don't forget anything. One of the components is genetics. Now, so biopsychosocial, the biological part we need to understand has many different 6 kind of components to it, right? One is genetics, and this, genetics comes into play, especially, and for those of you who've studied psych, twin studies. Twin studies are the ones that will kind of add a lot of credence to genetics, because especially when it comes to bipolar disorder or schizophrenia, is that twins separated at birth, and that they have that genetic kind of occurrence later in life kind of thing. So genetics is, and someone who may have a genetic predisposition to something. There's this saying, and it will come up on your midterm exam. Can't believe nobody's taking notes, but is that genetics loads the gun, environment pulls the trigger, right? Is that you can see that someone may have a genetic predisposition, and twin studies will validate that, but it doesn't mean it's going to happen. I have alcoholism through my whole family. If you look at either side of the family, it's just polluted, right? And I don't know whether that was whether there's that genetic predisposition for it, or whether it was environmental. Because when you look back generations, there wasn't the same amount of drugs, but there was alcohol. But trauma existed back then, sexual abuse existed back then, violence existed back then. What was available in terms of coping mechanisms was different, right? The Vietnam War is a perfect example of that, what became more available to people during the Vietnam War because they were in the Middle East, right? Opium was more, anyway, so you have the genetic component, then you have someone's individual brain chemistry. And we're all different, right? That although we all have all the different neurotransmitters, I was going to bring you a picture of the brain, I don't know how to do it. I like a very simple picture of the brain. Is that when you're looking at the brain and the different, this is so simple, right? The different sections of the brain and what it controls, the frontal lobe, the temporal lobe, the frontal lobe controlling problem solving, creative thinking, personality. This becomes important in terms of the biological, because what if there's head trauma? You have to know, interesting enough, you have to know what part of the brain was impacted, right? And this is why for those, did you study the brain in psych? Yeah, okay. I can't believe it's a little bit, like it should be tons.
Yeah, well,
Like it should be such a focus of study, right? The parietal lobe, that visual functions, reading, understanding, language. I'm gonna throw this up on I'm gonna send it to you on Moodle, yeah. The occipital lobe, the cerebellum, the balance, coordination, motor learning, brainstem. Like when you understand this part that the brain has so many, and it's so much more complex because you're talking about the midbrain, and like I'm not a neuropsychologist. I thank God there all the research is happening with D1 and D2 and D5 receptors for it's very complex, especially when it comes to levels of dopamine and what gets triggered, and it's just beyond me. That I'm a social worker, I'm not a neuropsychologist or neuropsychiatrist. But when you look at the biological factors, you look at someone's brain chemistry and the levels of dopamine, serotonin, norepinephrine, that there could be varying levels depending on your individual chemistry, right? Your individual. But there could be brain damage. So if there was some kind of head trauma, if like there was shaken baby syndrome, and that someone's brain was actually impaired as a result of that, or if, okay. Again, I'm gonna tell you stories, because this is what I bring to the field. There was a young person I was working with, he was 14 years old. He was put in group care, he was a temporary ward of the CAS. Mom couldn't deal with him anymore at home because he was so reactive. He was violent at school. They used to have to clear classrooms. And anyway, he was brought into group care, and he really struggled academically, right? So we had the privilege of having our psychologist. They used to do the assessments for us at Northern Lights programs. And so he did an assessment, and there were actually some interferences to learning. So we had this information, so you're trying to advocate with the school system to help him, right? But he also wanted to play soccer. So what we did is, it was in the summer, so we brought him to have his hair buzzed, because he had big hair. And the hairdresser comes over and says, "Did you notice the dent in the side of his head?" And it's like, no, we've never seen it because his hair was bigger than, and there was a considerable dent in the side of his head. And so we asked the mom, what happened? Like, what happened? Was there anything, right? It could be nothing, it could be an anomaly. Apparently, when he was about 8 or 9 years old, he was playing baseball with his friends, and somebody swung the bat, and when they swung back, they hit him flush at the side of the head, right? Causing. Right? Now okay, this is what we found out after. Then the mom said, oh yeah, and by the way, when he was riding his bike, he wasn't wearing his helmet, and he went head first into a brick wall. What's here? The prefrontal cortex. What does that house? The executive functions, planning, sequencing, organizing, time management, all those functions. To live every day and function and do well at school, short-term memory, they're all here, right? And that was damaged. And it's like, this wasn't the kid, this kid wasn't doing any of this stuff on purpose. We ended up having an assessment done, like Dr. Matheson had actually done the assessment and said, I need more information, because he was limited as a psychologist. The instruments he was using was limited to understand what was actually going on. So he made a referral to Dr. Mike Persinger. Now, if anybody went to Laurentian knew that Dr. Persinger was a neuropsychologist he just died a few years ago, but he was international in terms of his work. Anyway, it was so awesome sitting with Dr. Persinger, because this kid loved him. Like, here you had this world-renowned neuropsychologist, and Luke is sitting with him, and he's got a picture of the brain. He's holding actually a human brain in his hand. He was able to engage with this kid. It's like, this is awesome. Like, he had this ability. The reason he was going to get the results that he did was because of his ability to engage with the kid. The kid felt safe with him. He was going to maximize the outcome of the assessment because of it. And it turns out that this had very, very significant learning interferences and damage, not because he was born that way, but because of these two traumatic events that had happened to his brain. And now, guess what? This kid's not being a jerk on purpose, and he's not ticking people off and annoying teachers on purpose. He really is struggling with a lot of the things that have to do, that are neurologically based. Right? Now you understand it. Now your advocacy begins. You start with the school, and you get I have an IPRC meeting, and you create an individual education plan. And this is who he is, and for the rest of his life, because that's never going to change. The cells in the brain are never going to, and the brain and the spine, they aren't going to, once they're damaged, it's permanent, right? And so what happens is that whatever we do with this young man is going to have to solutions going forward, because there's going to be limitations, right? If we don't intervene now, his self-esteem, it was already really compromised. So you can understand how another path that he could have gone quite easily. But this is the importance of sitting and getting to know someone's story, right? Because that changed everything. Because we would have done behavioral interventions, right? Because that's what you're supposed to do, is behavioral interventions. But they would have been all off base, because I didn't understand, we didn't know what the origins of the behavior were actually neurological. It was a result of brain damage. It had nothing to do with having to do some CBT work and change perspectives or that kind of thing. So that's important. And this is how, it's so much work. Our work is so, it's heavy, and it's really burdensome, because we really need, if we're really working and we really care about that person we're sitting in front of, we need to do our homework and find out more. So there's the genetics, and then there's the brain chemistry. There could be brain damage that had happened. There could be physical health, like if someone was actually experiencing in utero, if the mom was having difficulty in utero, and how that could have, an example could be, if the mom drinks, if the mom smokes during pregnancy, if they ingest. I know, especially when you look at fetal alcohol spectrum disorder, is that like it's quite varied, right? Because you could have FASD, fetal alcohol, and that's when you're very specific. You know someone has FAS by their nose, by how far apart their eyes are, the flatness, the most telltale sign. Does anybody have the most telltale sign for FAS? Is they have no filter. You know this bump that you have above your lip here? If you look at any pictures of someone with FAS, fetal alcohol syndrome, they don't have this. Google it. Google FAS. And you're going to see that they don't have this. And that's almost, this visually, once you're in the field for any length of time, you're going to see these small things. And if you have that, then you know that there's been some kind of alcohol-induced brain damage, right? So there could be, or if I know that there was, when I worked again in the group home, there was a young man that I worked with that was very erratic, very impulsive, very aggressive, had probably the beginnings. He had reactive attachment disorder. Does anybody know what that is, reactive attachment disorder? He was actually born addicted to cocaine because his mom was a coke addict, right? So and you have to think about this. Anybody seen a little infant child? This child spent 4 months screaming and crying, withdrawing from cocaine, right? This was the beginning of his life, right? So this is how it his life kind of started. Right? Did you look up at SF? Yeah. Do you see the picture? Yeah. 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 So what you can you'll be able to tell there is no filter. There is no space. So you can, and that's something when you're looking at physical damage to the brain, is that when you see that. Now FAE, fetal alcohol effects, looks like so many other things. It looks, from a behavioral perspective, it looks like non-compliance, it looks like reactivity, but in actual fact, fetal alcohol effects is brain damage, because when a mother drinks alcohol during pregnancy, alcohol passes the blood-brain barrier, so the kid, the infant, gets drunk, right? And where does the alcohol go? It goes directly to the brain. And it's almost like if anybody's ever drank, not I'm sure they have, but the next morning, what do you feel like? You just want to drink, you just want to drink water more and more. Because the alcohol, it does the same thing to the cells. It sucks. Yeah, and so the brain cell dies. Wherever the alcohol travels in you or to the baby's brain, whatever stage, first trimester, second trimester, because all kinds of different things are being developed at different stages in utero, and that could be an end result. You could end up having that part of the brain could be damaged, and it's not going to repair itself. But these are the things when you're sitting with someone, you have to get people's history, you understand. It's very intrusive, so you really have to have a skill, but it's also really important to get that knowledge so that you're not coming up with the wrong treatment plan. There also could be interferences to learning that have to do with, and when people, anybody's ever heard anybody from the Learning Disabilities Association of Sudbury, it has to do with levels of receptors. I don't understand all of it, but again, interferences to learning. I don't call them learning disabilities because I don't think they are. I think they're interferences. I think everybody can learn, that you just have to find the way that they learn. Anybody from LDAS, well, I've arranged for presentations, but it's just they have this vast body of knowledge that helps you understand what's happening to, it has to do with the neurotransmitters, and it has to do with receptors and how long they are or short they are. I don't know, but the thing is, it's neurologically based. It's not, someone's not trying. It's almost when people will say, well, read it again. Well, I don't understand this. Well, read it again. It's like, well, I would have been able to read it the first time, I wouldn't be asking you, right? And it's again, listening when someone talks to you about their story and you ask them about who they are and their story, you have to be listening for all this. I don't know, I think you're going to be taking a counseling course, but you should be sitting and listening and attentive and in the moment, but at the same time, your brain's like, like you're firing on all cylinders because you're trying to listen for all this information and record it like somewhere. That's why you take your notes after. So there's a real skill in learning, and it takes years to develop that kind of, it's not something you walk out of the field with. You learn to develop that and really to listen to somebody, right? So you've got those biological factors, which are genetics, brain damage, brain chemistry, physical health that may happen, any interferences to learning, and then someone's IQ, right? Because that's something that can, but you know what's interesting is that you can do an IQ test, and basically what that does, that IQ quotient only tells you their ability to recall taught knowledge to this point, right? Or what acquired knowledge to this point. It doesn't tell you about their emotional IQ. It doesn't test, because when I worked with kids from, in another group, they were from Northwestern Ontario, they were from the Kempston, North Spirit Lake, and a lot of Aboriginal youth from way northern Ontario. You try to do an IQ test, the performance was going to be up here, and the other was down here. Like, it was so different. The variance was so much, so they were often tested like they were below, under 70. Right, instead of actually their performance IQ was really high, but it was so skewed that it didn't balance properly. So the only thing, and then we have to be very careful that when we read someone IQ score, they'll say and they'll also say there's a learning disability. Well, why? What is it? Tell me what it is. Be specific. Is it interference? Is it a process? Do you know how many interferences to learning there are? I'll bring in a sheet next week. And how vast learning disabilities are. Because a lot of the young people that you're going to deal with that have an addiction to marijuana that's their drug of choice. But that's because often they have, there could be an interference to learning, and this is how they cope, because I'm dumb, I'm stupid, kids with ADHD, because it's a prefrontal cortex issue and a basal ganglia issue. They're not doing this stuff on purpose, but they know when they smoke weed. For the first time, my brain's not working. So we have to appreciate that there is this whole biological, with all those dimensions under biological factors. Does anybody think of anything else that I may have overlooked from your field of study? I'm not from you. No one knows it all. I keep learning and growing as I know. Then I'm going to go into the social is going to take a little longer because that's loaded, right? That's totally loaded. But a psychological, then there's the biopsychosocial, the psychological. Has anybody here ever been called, when you were young, were you ever called stubborn?
Yeah.
Which is interesting that you're in this field, right? That I think is one of the highest compliments someone can pay you. But it doesn't feel that way when you're young, because it's almost seen, well, you're so stubborn. Because I won't say it like this, right? Like there's something wrong. And it's interesting because my daughter used to be called stubborn, except by my grandmother, who said, she's determined. I'm like, that's the same freaking behavior, but because somebody called it something different, all of a sudden, it's a really admirable trait to be determined. So now, if someone calls you stubborn, I love when kids will tell me when I'm working with them and they'll say, well, everybody says I'm so stubborn. It's like, awesome. But they don't know it's awesome, because that means whatever you want, you're going to get. No one, lead, follow, or get out of the way. Like you just, you are determined. You want something, you go after it against all odds, you accomplish, right? And you don't, and you may have to feel like you have to bully your way through things, but it's like, you may have to do that. So that's one of those psychological kinds of traits. You were just kind of born that way. It's interesting that you look in families. For any of you who you come from, how many people in your family?
Just 4. We just 2.
Just 2. Okay.
Yeah, siblings.
Are you exactly the same? Are the 2 of you exactly the same in nature?
No.
Like almost opposite?
Yeah.
What's the difference in ages?
It's 5 years. He's younger than me.
Okay. So he's male and okay.
Yeah.
Why the difference? Yeah, same parents?
Yeah.
Same home?
Yeah.
Same upbringing?
Yeah.
Why the difference? You're kind of looking at that. And for you, how many siblings?
Just one.
Okay.
The brother,
And
he's like entirely different than me.
how is that?
He's more social and more kind of an introvert.
Same family? Same parents?
Same parents, but he's like 11 years older than me.
Okay, so that could
yeah,
contribute
could
to
be,
some
yeah.
stuff, yeah? How many in your family?
I have 4 half-sisters and 2 from my dad's mom. So my sister is 7 years older than me. We're completely different, like completely, not even close. We would never be even friends if we're not, because like, we're that different. Like she's like, everything's organized, everything's like, he's planner, he's like formal. I'm just completely opposite.
Very good. How many years?
I have one younger brother.
And are you exactly alike?
Completely.
Completely. How about you?
Which one was like one stepsister and sister.
And very different, same thing for you? Why is that? Same parents, right? For the most part, you've had the same parents. There might be because there's age differences, there's gender differences, there's different variables involved. But and someone so it's gotta be something else. It's not, you're kind of born with it. And so when people talk about the psychology, it's just the kind of nature you're born with. Because when you don't train people to do something. It's interesting because years ago I taught a course in sexuality, and I had someone from the Access AIDS come in, and talked to the class, and he said, I asked everybody who was left-handed to come up to the front of the class. So there was like 4 of them, and they were standing, or 5 of them, they were standing there. And he looks at them and says, what's the matter with you? Why are you left-handed? Why aren't you using your right hand? Why are you choosing to be so different than anybody? And he was really aggressive, and they felt so attacked. And then he said to them, no. And their answer was like, it's just, when they were young, they just did it. It was automatic. They were left-handed. But his point was, we are born a certain way. And that's how he explained being gay or lesbian or trans, is that it's who you are. From your birth, this is who you are. You don't choose this. It's an automatic kind, and it's so, this is that psychological kind of equivalent, is that this is, you're kind of born with these natures kind of thing, right? In my own family, one of my sons, he's married, and his wife is interesting because her parents are German and Korean. My son's have Irish and ethnic background, but she's German and Korean. So they're 3 kids. The oldest one, Aiden, has got like brown hair, brown eyes, has some of the Korean kind of features like her mom. Their son, Casey, blonde hair, blue eyes. Don't even freaking like they belong in the same family. And Aiden is so quiet and gentle and a caretaker. Casey is like, where's the highest tree, kind of thing. And then the third one is that she's got gray eyes and like auburn hair. It's like she's sort of like a little bit of the Irish kind of twist. It's like these are the exact same parents. And actually the youngest is the one that is the least compliant. In fact, she came home and complained to her father that the teacher kept interrupting her. So these natures are so different with the exact same parents. So it's the same kind of thing. I think you're kind of born that way. So when you look at the psychological factors, you're looking at someone's just their nature, how they see themselves, right? It's their IQ could be part of it, and you're born with that. Right? You're born with the capacity to learn. Now, social determinants of health, opportunity really play into that, but everybody will have that capacity. Whether their capacity is actualized, depending on opportunity, is something different. But there are some people that are just going to have, there is a limited, for whatever neurological reason, there's a limited ability to acquire knowledge or information, right? That's not good or bad, it is what it is. A part of the psychological is someone's social skills. It's interesting because probably from birth, from very young, you were just kind of shy.
Kind of.
Yeah, it was just kind of your nature to be a little bit more reserved, and that's just someone's nature, right? That doesn't mean that in certain social situations where you feel comfortable that you aren't to work up, but generally, it's just sort of how you are, right? It's, stubborn versus determining, memory, perceptions, beliefs, ability to handle stress. It's like sometimes it doesn't make sense that some people, it's just their nature. Not everybody here could be a paramedic. Some people are incredible. I have a son-in-law, incredible in crisis. I want him around when bad stuff's going down because he doesn't panic. That's his nature though. Do you have someone in your life when you think about someone, it's like, you really want them when you think about first responders, when you think about paramedics, you think about firemen, you think about medical doctors that emerge, like they're dealing with, this is crisis, right? And they don't panic in this. They're could you do that? No, could you do that? Neither could I. But it's like they were always driven to do that kind of thing. They have that ability or skill. That's their own kind of makeup. And thank God, how people's brain works differently. This wonderful human being next door, Daryl, who's the computer with, like his brain is so different than mine, I'm totally dependent on his ability, is that thank God we have these differences, right? But that's how he was born, with the brain being wired differently than mine. So that's someone's individual. Now we're going to get into the social. And this is when things take off in 1,000 different directions, right? And where the social determinants of health come in. What time is it?
It's 9:15.
9:15? Okay, so we can get into a bit of it. So what I'm gonna do is I'm gonna shut this thing down and I'm gonna draw pictures because I think they can see that back there. We're going to, has anybody ever heard of, oh, is this old school? It is. Is it?
I think there should be something to scroll up.
Yeah.
It's an automatic scroll.
Do they not?
Yeah.
Yeah, most of that, that's why I was looking for the remote, but they're not, it's not here. Oh, son of a, can someone else, I actually hurt my shoulder last week. Pulling the cord on the lawnmower. Just pull it down and see.
There should be an option in the remote.
I know there should be. I'm looking for
Can
it.
you just?
Usually there, oh, maybe there? Oh, you might be right, hon. Well, thank you so much. See, always. And that's a perfect example in the field. That's a perfect example in the field.
It's coming.
It can't be just one person. Like, thank God you knew that, or you kind of forced the issue?
We, back in India, we use this a lot, so.
Yeah, well, I probably should have known that too, but anyway. But not, oh shoot, not one person knows everything. That's why I love teams. At Sassy, do they have team meetings?
I've never been to one yet.
No, great. Has anybody been part of a clinical team?
Yeah.
Okay, so you're, how important it is to bring, what disciplines set at the table?
I believe teamwork is everything to put,
Yeah.
something into work.
Yeah, and how important that is. Okay, is that, anybody ever heard of, let's just look at some of the social factors that would contribute to, when you look at a human being. One of the things that we look at 100%, are people familiar with the social determinants of health? Opportunities that give people or rob people of opportunity. One is their economic status. Poverty is a huge factor. You have to understand someone's background. How does poverty factor into it? Just think, because this whole course is about how to think, not what to think. How does poverty, how could that be a contributing factor?
Determines what you're exposed to, the resources you're exposed to, information.
And specifically,
I mean, you choose, like, sometimes if you're hungry, what is cheaper, for example, I'm saying, like, let's say that getting drugs is cheaper and gives you last, like, longer period of, comfortable.
as a young child's body is growing, they need nutrition, their brain needs, their body needs nutrition, right? If you have limited financial resources, then, I just bought apples last week. Like, they're $11 a bag. But I can go and buy Joe Louis or those puff-filled pastries for $3. And if I've got 3 kids or 4 kids, I can stuff their lunch full of stuff that keeps them full for a few hours with stuff that I can afford. Because if I'm a single mom and I'm on a limited income, I can't, although I want to provide all those things, and you just can't. Healthy food, how much is the lettuce? How much is a cucumber? How much are healthy, nutritious foods that feed the body properly? And you can't afford it. Not because you don't want to, but if you're in Ontario works or you're on limited income, and then what happens is what happens with clothing?
Like having a house and a roof on your head that is safe, That is a huge thing too, because your body cannot rest for the night if they are not in a place where they can safe.
I'm going to talk about Maslow and how important, how you have to think, when you're actually sitting and doing an assessment with someone and gathering information, that you're writing down stuff like like when I actually sit with someone, I'm writing stuff all over the place, because I'm not trusting my memory. I'm doing everything, it's right in front of you, so that if you and I were sitting together and I was learning more about you, you would be seeing what I'm writing, because it's not a secret. These are not my clinical notes where I'm trying to keep, this is your life we're talking about here. So I do a very visual representation, and I gather information. I'll show you how I do that after. But things I have to keep in the back of my mind, and this is why, as grads going in the field or just starting in this kind of field, a very complex field of mental health and addictions, how critical it is to gather as much information. The more work you do ahead of time, it's almost like when you write a huge research paper. You gather. I remember when I was doing my master's, I had like piles of stuff all over the place, because these are your reference materials, right? And then what you do is that when you're ready, you put it all together, right? Then when it's time to do it, you put it together. So it's the same kind of thing when you're doing an assessment with someone, is that you're gathering this piece, bio, psychosocial, cultural, spiritual, you're gathering all this, so that when you're actually sitting with someone, it's a constant way of learning about someone, so that you devise a treatment plan that's going to be successful for them. Follows guidelines, but is customized. Right together. So we look at economic status. At poverty, it impacts nutrition. It impacts the neighborhood you live in, right? And when it impacts the neighborhood you live in, it's like what recreational activities are available. Some kids can go, if there's no financial restrictions, they get to play AAA hockey. They get to maybe travel, be on traveling teams. A kid could have a real athletic ability, but if the mom is by herself or they don't have the financial resources, then they'll never actualize their potential. I remember trying to advocate for kids. He was a young person, he was a Crown Ward, and he played hockey, but he wanted to be a goalie. I don't know if anybody knows anything about hockey, but like a helmet's $1,500, and then you got the goalie pad. Unless you have someone who's willing to pay for that, the kid never got to do it, because the CAS was not going to pay that. So that opportunity that he could have had was out of his reach, right? So these factor in. But when you are sitting and listening to someone and you're listening, is this something that they wanted to do? Do they have some kind of ability in their strength or something? Faith and religion play a huge part, right? It's very interesting, because as I've been teaching this course over the last couple of years, is I've had the chance to listen to students from various parts of the world. And it's interesting. First of all, having a mental health issue in some countries is not okay. Being gay or lesbian, not okay. And so, depending on what someone's religious beliefs are, not spiritual, but religious beliefs are, that impacts. I mean, I'm Catholic, so you feel guilty about everything. It's like you're trained from the womb, to feel guilty about everything. And you're gonna go to hell if you don't do this, you're gonna go to hell, whatever. So you get trained, like your mind gets trained about certain things, and you gotta realize that sometimes you have to unwind those tapes kind of thing, and you have to see why someone walks the way they walk, or thinks the way they think. You have to know what that is before you can challenge it, but that's CBT, we'll be talking about that. It could be their peer groups, and were they positive, were they accepted? When you think of back in high school and all those kids, the subgroups, like the stoners, and we talked about that last week. It's interesting that the kids who are marginalized are the ones that will be there for each other, right? They're the ones that will give each other their last cigarette, and it's a whole different mindset. They don't rat on each other, they'll lie for each other, and it's like other people from other maybe socioeconomic stresses, but these ones for sure, they don't turn their back on each other. Not because they're afraid of each other, you just don't do it. It's like a silent code. relationships and interpersonal, like, when you think about it, if there's a lot of financial stressors, because I work with, in my private practice, I also work with couples, right? And then when you look at the variables that impact on their relationship, a lot of things that people tend to argue about are two things. One is finances, the other is parenting, right? And if you have a lot of financial issues and a lot of stressors, and you're having to work, and that might mean you're having to work 2 jobs, and that results in you being tired, and then if you're tired, you can't function. You can break anybody. You can break the most intelligent person by depriving them of sleep. Right? They used it as a form of torture during World War II. They wouldn't let anybody go into REM sleep, which is where we work stuff out, right? When you're deprived REM sleep, then you haven't done all that work that's required to work out all that. Because in your dreams, don't people come from all aspects of their life? The past, the future, the past is in now, and it's like people who don't know each other connect. It's like there's no, whatever the dreams allow us to do, they allow us that kind of release. So when there's all these pressures and stressors, and we're not sleeping, we're edgy, we're bitchy with each other, we're short, and then we become not the best parent we want to be. We might be more reactive. If we come from an abusive home and we swore, I'll never treat my kids like this, I'll never hit my kids, and then under stress, people end up doing what they swore they'd never want to do, and it's the situation more than anything. So you look at how financial stressors just feel so overwhelmed, and then the guilt associated with not being able to provide all this stuff. I was a single mom too, right? And I couldn't do everything I would have liked to have done for my kids, and so you feel kind of, you got guilt associated with that. And then when it comes to parenting practices, this is where a lot of relationships end up are very different too, because we parent the way we were parented. What other frame of reference do we have? Right? Or people will break into generational trauma and square battle, then they try to break that. But when you've got some of these social factors going on, it's your own upbringing, your own parenting practices. Well, my dad hit me and I turned out okay. No, you didn't. You're really angry, so you didn't. So that kind of work on. Then there could be culture and beliefs. There's certain things in terms of, not having sexual relations before marriage, or these kinds of things, that someone comes from a different belief system. How culture impacts from, like, you joke about the Jewish culture, the Italian culture. It's real. Like, you better show up at Nona's on Sunday for that Sunday meal, because that's what's expected. And I don't know if other cultures have, does your family have traditions where you're like, oh my God, if you don't go home for Christmas, it's like, no? It may be some, do you have any traditions that are kind of held sacred? What traditions are held sacred?
Like the family has to get together for any of these, like Christmas or Easter, whatever it is. Like, you might be busy, it does not matter. You might have like something going on, it does not matter.
Family first,
Yeah.
right? But what if there's something really important, or you're in a relationship with someone who doesn't feel that same way, who doesn't hold that, who doesn't share those same belief systems? It's like, you can see, right? So culture does impact, this is how we should behave socially, right? That socially we need to, family comes first, but you are conditioned to believe that. Right? So we have to look at how important that is. Oh, I have to. How come? Because I have to. Why? I have to. Like, I don't know. It's just a kind of even question kind of thing. Gender, who you are. Like, it's funny because when we talk about whether you're the oldest female, who's the oldest in the family? Okay, your siblings owe you big time. Right? Because your parents, honest to God, I'm a parent. They practiced on you.
Right.
Your parents. We don't know what we're doing. As a parent, we have no clue, right? Because we've never been that before. So the first time we ever do it is like, okay, we don't. So we try our best. So anybody, especially when it comes to discipline and that kind of stuff, if anybody's got half a brain that came behind you, they're going, oh, I'm not doing that. And so they learn what not to do. So your siblings actually do owe you big time. So you can call in that marker at some point when you really need it. Because birth order does, and if you're the oldest, like I have a brother that's older, a really highly accomplished individual, and then you're running second, but I'm the oldest female. Well, and then my mom worked full-time, so what is automatically, some stuff fall automatically to you, the roles, responsibilities. And until you question it, you just fall into it. You know, I'm quite sure somebody else could cook Christmas dinner. In fact, it would be awesome if somebody did it. But it's like, you've got this role that you're supposed to be, you're the oldest, like I'm the matriarch of my family now that my parents have passed away. It's like, how about everybody do a potluck?
Yeah.
That's a lot of work to create a Christmas dinner. If there's been trauma in the past, and that's a social thing that happens. And that's not even, I mean, how you magnify being physically abused. You magnify being socially abused, because sexually abused, because this is real. When you look at neglect, when you look at if there was trauma in, if the mother, you know, if the mom was in hospital and had or depression or psychosis, like postpartum depression, or had psychosis as a result of childbirth, or if the you know, someone came into their existence as a result of a rape or some kind of situation and they don't bond with the child, is that, you know, you've got a lot of this trauma. If trauma has happened in someone's life, there was a young boy I remember many years ago that I worked with that, see, this is when you work in the field, makes sense now when you understand things, is this young boy he would always walk in circles, but he had we didn't understand it in trauma when, like, back in the 80s, like we didn't, 90s, even the 90s, we didn't appreciate what trauma is and now we understand it. But this was a young man who was at his picture window and watched his mom stab his father to death. Like, he witnessed this violence, right? And so then there was another young man that I worked with. He was a ward of the CAS, but he was in foster care, and you looked at his feet and they were full of scars. The punishment would be, his foster father would immerse his feet in boiling water as a punishment for misbehaving. That's trauma. And if he's reactive, he's angry, he's walking around the world with a chip on his shoulder, yeah, 100%. Because what did he do wrong? He didn't even know, and this is especially true of kids with ADHD, is that they don't even know what they did wrong. Right? Is they do stuff, there is impulsivity, it's like that, when we get into ADHD, we'll be talking about it, but there's this phenomenon that happens with ADHD. It's almost like if anybody's ever skeet shooted or shot a rifle, there's a thing that you do, there's a process, a system that you use. You ready your gun, then you aim it, then you pull the trigger, then you fire. Someone with ADHD, because of the neurology of ADHD, it is not a behavior, it's a medical diagnosis. And what happens with them, it's like, ready, fire, aim, oh shit, right? And then it's like, oh, they just realized what they just did, I should have done that. And now they know they're gonna get in trouble, so they hide, they stay, or they don't tell the truth. They lie like a butter, right? Because it's like, oh, I didn't do that, because they know they're gonna get caught, but they're just putting it off. They're delaying the consequences. Because they know, and then why did you do it? I don't know, and they don't know. Because it has to do with the basal ganglia, it has to do with impulse control, it has to do with neurology, and that inability to kind of turn that switch off, right? That impulsive switch off. So when you've got, when they behave in a certain way and there's neurology attached to it, there's a medical, but if there's trauma and it's not their fault, it's still, they end up living that there's something wrong with me. There was a time when I worked in Toronto, I had students in Toronto at the Red Door Shelter, and these were people, immigrants that had come to Canada. They were coming to Canada, but they were housed, and they were from a lot of war-torn countries, and they were housed in this one, the one I worked at was called the Red Door Shelter. I had students placed there. And so they were just waiting for papers to be processed and stuff like that. But these moms would come like with 6 kids or 7 kids and live in this 10 by 10 room. And it was a real poor area of Toronto. I remember going in to do my placement supervision. with the student, and I had to walk over a dead rat, like to get into the church building itself, right? It wasn't the best condition. But it was interesting, and so my students had to place kids in schools. But it was so different because these people, the young kids had come from war-torn countries where bombs dropping and war was around them all the time. That for us, hearing this would be nothing. But for someone who had been subject to violence, for someone who had been subject to that survival stuff, like when I think of these poor children in Ukraine right now and when they're coming over here, that they're 100%, you're going to have to be very loving with them because they will have experienced so much trauma, right? And so it's understanding someone's background, if there's been violence in their family, where they come from. But these young children would be, it was very interesting what happened, that there was a daycare as well. And my face was sore from smiling when they would come up, because these kids didn't even speak they didn't even speak the same language. They were from every part of the world, and yet they were talking to each other. They were communicating. Somehow they understood each other. And it was the most beautiful thing to witness, the innocence. And then you thought, prejudice is taught. They didn't have this. They didn't see anything. They didn't see different cultures. They didn't see different, yes.
And I think that when you are a kid, it's important to consider that you're not aware of that is a trauma. You're just like, for example, my dad is Colombian and he grew up when the guerrilla was starting. So
Yes.
he was used to a lot of violence. He moved out of there and they moved out of there and all of that. And when I was growing up, my dad, as a Colombian, when we used to travel, they all would search for drugs in your bag, even I was a kid.
Yeah.
So for some reason, and I didn't realize that until like 5 years ago. I'm 34 now. Yeah. And that happened when I was like a kid, 4 or 5. And now I don't, and it's horrible to say that out loud, but like, I don't trust the police 100%. Like for me, police is like, because they're gonna look for something. I don't have anything to hide, but it's just that feeling.
It's just that fear of the power.
But it's not, and that trauma is just back there. But when you're a kid, you just don't see it like that, and you just get it more and more and more and more. And when you're an adult, kind of like, okay, cool, this is not, something is not working hard. Something's happening.
Yes, and we get triggered by things, like if I smells take us back like that, right? Music is the most powerful. It takes us back, like you could hear a music and you would hear a song and all of a sudden you're 14 again. It's so powerful. And often trauma is associated with something, some physical sensation, whether it's pain, it's hearing, it's one of our senses, it's a sensory event, right? You're seeing this, you're seeing the police, or you're hearing something, or you're smelling something, or you're tasting something, or you're physically experiencing something, but it's a sensory experience. That's what trauma is.
And your body gets tense, like your body just changes. It's not the same as it was like normal.
Yeah.
It just like changes completely. You're just like, you freaked out. You really are like in shock.
And this is where understanding neurology, because you know what that is? That's your primal brain. Your primal brain has taken over. And so this, that is so important in understanding fight, flight, or freeze. Because that all starts from here, and it's about protecting ourselves, because our primal brain goes back to medieval times that we had to be alert, we had to be cautious, because we were living in the elements, and there were wild animals, and there were mammoths, and there was saber-toothed tiger, that was a real thing, right? And so we had to always be on alert. If we let our guard down, something bad was going to happen. It's the same kind of phenomena that happens when we run into trauma and we run into an experience, is that this part of the brain like shuts down, and we go into fight, flight, or freeze.
And that is what therapy helps through because you need someone that tells you like, hold on, you need to that's okay. And that's what happened with me with therapy. Like I went through like, you are not in a word, you need to kind of like realize that it's not that, but it's a lot.
Trauma, it's interesting because the person that, like my older brother, is actually a therapist as well, and his area of expertise is trauma, right? In fact, he does a lot of work with the paramedics here, and he works with a lot of the police and paramedics in the city in terms of the trauma response. Because there's things like the MDR, and that they use different methods to help people through trauma. But it takes time for that kind of experience, that it isn't an automatic kind of thing that you're going to be able to, you have to be able to figure it out, and the process is very deep, yeah. But that's the work. So, and it's the same kind of thing, when we're dealing in the field of mental health and addictions, the more I tell you, will tell you, more than 60% of them have lived some kind of trauma. Some of it can happen. You're prescribed opiates, and we're going to be talking about that, and then you end up with not just physical, but a psychological dependence. But a lot of the stuff that the coping is, that's the board said, why, not the addiction. The question is, why the addiction is why the pain. So you're going back, and it's your lived experiences, and some people are very differently. People go through childbirth, women will be screaming and yelling and whatever kind of thing, and then there's other women that don't do that at all. I remember I could hardly wait, every contraction. I can hardly wait to meet my child because I don't know what this person looks like, right? But and then you hear other women screaming, because it really depends on your perception and whether you can summon the endorphins in your own emotional state, and whether you can do that kind of thing, right?
Yeah, that's what I think my dad got Alzheimer's on. Like, the part of his brain just wanted to shut that down.
Oh,
and
I know.
memories. And I'm not a doctor. I'm like, this is coming from where I see things. But he was diagnosed with Alzheimer's like a year and a half, like everything. But the things that he did when he was younger, he was showing like red flags, like he put that things, like all of those things. But we didn't see it as that. But I think part of it is his childhood was a lot of trauma and a lot of pain. So some part of his brain was like, you know what? Let's close this.
I have to, it's like I can't
I need
anymore.
to survive.
I can't anymore. I mean, I've actually worked with kids that with, I don't know if it was drug-induced psychosis, like catatonic, they were catatonic. That's a very interesting thing to watch, by the way. You've ever seen somebody who's gone catatonic, and you don't move until you move it. Like, it's very interesting. But there's so much we don't know. Like, there's so much research that's being done right now. Like, I'll read something from you after in terms of just research now with CAMH and about neurotransmitters. It's great. Okay, there could be family circumstances, like I'm hearing, 60% of relationships end up in divorce now. I'm gonna bring you married. Like so it's just the way, and it's understanding that that's almost normalized. That kids are gonna have two sets of parents, kind of thing. But depending, and my experience has been in my private work, if parents divorce well, kids divorce well. If parents don't, right in the crossfires. I mean, and I see it. Like, I know we talk about it, it's a stat and that kind of stuff. I sit there and I listen to these kids, and I just want to take parents and just smack them. I seriously do, right? And unless there's trauma, unless there's abuse, unless there's been physical violence or something like that kind of thing. But I mean, if it's just because they're mad or they're angry or that, the kids are so smart. They really are very smart. There isn't a kid that I've worked with that doesn't sit at the top of the stairs when their parents are fighting. Because they have to know what's going on. Because they have to, whatever happens with their parents is going to impact them. Oh, and I know parents will tell me, well, they don't know what's going on. It's like, they're listening at the top of the stairs. They've got their ear to the radiator, so because whatever, they know everything that's going, or they have to know what's going on. But a child can only tell you what a child's brain perceives a situation to be, right? They don't get the facts. They're going to hear it. This is like a perception thing. And how important it is when we're sitting and listening to someone is to not negate their experience. When I was working at the Sudbury Government Hospital, we were in the kitchen because they had these cottages, right? We're in the kitchen, there was this kid named Wayne, and he was talking about, to the other kids at the breakfast table, about how he saw, what was it that he saw? I'll use an elephant. No, it was what was it? It was, let's say it was an elephant. It was some kind of large animal that he saw at the zoo in Sault Ste. Marie, because that's where he was from. Anyway, so he's talking about it, and the room was probably, the kitchen room was probably about here to here kind of thing, right? And so he said, it was as big as the room. And the kids, everybody started to make fun of him and laugh at him, and he was getting angrier and angrier because he was having to defend himself. Like he said, no, it was as big as, and he was getting more angry and more angry. Then someone asked, how old were you when you saw the elephant? And he was like 6. What? When you're 6, you're like this,
Yeah.
and you look up, how big is that elephant? It's the entire room, right? And just asking the right questions just is now, it's not my perspective, what do you recall? What was your perspective of the thing? And that changes everything, right? So when we're looking at someone's trauma or their family circumstances, what they remember is what they see. I don't know, when you sit together as a family and you talk about things that happened in the past, you'll say stuff and it's like, oh, I don't remember that. Do you remember this? No, I don't remember that. We remember the things that emotionally impact us the most. So when someone is telling you their story, they're telling you their truth. No one is lying, but they're telling you their truth or their perception of the truth. Then there could be,
Do you mind us taking a 2-minute break?
yeah, do you want a break? Sure, let's do that. Yeah, let's take a 10-minute break.
Everybody's fine with that?
You know, we should be, and you have to interrupt me, because I actually, you know, when I do sessions, I do marathon sessions, right? I can easy go an hour and a half, 2 hours worth of session. Yeah, take a break, take 10 minutes.
Sorry to interrupt, guys.
No, that's right. You stop me because I'll keep going, and we should take a break an hour and a half into it at least.
Yeah.
Bye-bye, love. I gotta go get some money. Sorry, I should have my phone. Remind me to turn the recording back on. Oh, I gotta turn. Is the video going? Can anybody up there tell me if you can hear me?
Yes, we can hear you.
Yeah.
If you guys have any questions, you're just gonna interrupt me. I'm so far away from the screen that I can't tell if you have questions. So you're just gonna have to like go Mo or whatever, and interrupt. I would prefer that if you have questions, because it's sort of like you're sitting in the classroom, but you're not. Well, there's 3 of you anyway, whose faces I can see. Well, I can see pictures of you. I don't see you, but the glories of Zoom. Anyway, so where was I? We're talking about Dr. Unger and the whole concept of resilience. And then if people who have actually, you've had to gone through some trauma. This is why I believe those people who work in our field, who've had difficult times in their life, who've gone through some struggles, who maybe dealt with addiction. You're going to actually hear, there's someone that's going to be presenting to you that's actually a recovered alcoholic, right? And he's going to talk to you about what it's like to be him and how many times he went for treatment, and you're going to hear a story. Do you think there's nobody better at the work that he's doing than him, right? Because he's been there, done it, bought the t-shirt kind of thing. And the same thing, if we in ourselves in our own life have gone through some kind of event, and we talked about that last week as well, is that we bring, if it owns us, then it turns into counter-transference issues. If it doesn't own us and we process it, now it's a gift we give away. Like for someone who will come and talk to me about being sexually abused, and it's that they'll know, there's gonna be certain things I'm gonna say that they'll know that I get it. I don't have to pronounce, oh yes, you just will know by how you respond, that you bring this lived experience and what you become. That's the goal, I think, of when you choose to be in the helping profession, especially in the field of mental health and addictions, is that you become who you needed when you were a kid, right? Like could you imagine for your dad, if someone could have been there, you know what I mean? And understood him and stuff. So you become that. Because as a kid, you know what you needed and someone did not provide. Well, that becomes an incredible body of knowledge for you, that this is what you now can give away. And when we get into talking more about addictions further on in the course, is that when people, they call it fall off the horse, when people relapse, it's not a bad thing. A lot of people feel like that, very judged if they relapse, but the thing, every time you relapse, you learn more about what you didn't know, and now you kind of change your strategy. I learned something about what was not successful. Obviously, when I had a plan, I didn't think about that variable or that variable. Now I know that, so I build this into my recovery plan for my next attempt. It took me, I don't know how many times, at least 3 times to quit smoking before I actually did. I had to fail, but I didn't fail. I learned, depending on your perspective on things, right? It's the same thing, but that's how you choose to think about the field of addictions. If you don't think that way, then it could be, you'll come across, whether you mean to or not, as judgmental. Okay. So when we're looking at, this is actually, when we're looking at the social factors, these are so complex. This is the way I gather information, right? One of the ways I gather information is by looking at someone's social structure and who they are. So you start with, if it's the person that you're working with in the middle, right? You're looking at, I don't even like the word client, I don't like the word patient, I like the person like I'm just the person that you're sitting with, right? In psychology and social work, it's referred to as the identified client, I think more than, right? Okay, so this is the person in the middle. Now, when you write this, and I will draw this, I'll sit there with this person, and then you're writing up, now what am I gonna put in here? I'm gonna write their psychological stuff. I wanna look at their gifts, I wanna look at their abilities, I wanna look at their strengths, I'm gonna use a very strength-based approach, right? And in this system, this is all from Grothendiener's systems theory, because he believes, his thing is that social environment affects human development. It connects sociology and psychology, it really does. And Margaret Mead, who is the anthropologist, will tell you that if you've done any of her reading as well. Okay, so in the microsystem, who's in here is the person, but all the people they have direct relationships with every day, because whoever they are impact them. It could be their mom, it could be their brothers, it could be for kids in care, it could be the other kids in the group home, it could be the staff, it could be the teachers. These people affect their world every day, right? So you put them in there. Like, I have a different way. When I create this on someone, I do this, because I look at, I make spiders out, and I look at school, I look at sports, I look at friends, I look at family, but I look at a way of recording. I have to record all this data, right? To understand who someone is and who's affecting them, because I need to know who's affecting their world every day. So for kids with anxiety, especially if you're working with young kids with anxiety, a lot of it has to do if you find out who's on the school bus, because a lot of kids are bullied. If you don't find out what's going on in this world, who's bullying them, where's the bullying, is it happening on the school bus, where are they sitting in, it's details. It is the fine details in our work that make the difference in understanding that kids or that person's lived experience. It may seem insignificant to you, but not to the person that's experiencing. You have to hear their narrative, their story. So you put in the microsystem, so this is the micro, all the people that affect that in that person's life. Because if you're creating a treatment plan, if I'm working with someone with an eating disorders, which I used to do, I can't just work with a person with the eating disorder. Where do they live? Where do they eat? I'm only with them an hour a week, or they're only in a treatment program or an outpatient treatment program, like for a certain period of time. They go back home to live. If I'm not working with the family, and it's the same thing that happens with psychosis when we developed the psychosis program. If someone has experienced psychotic events, I don't live with them. You're the clinician, you're the mental health specialist. You're not there taking care of them 24/7. You're the one they come in to see. They get to leave and you get to go home, right? So who's ever in their life is you're going to have to be working with these people as well. And you have to look within this microsystem is your support system. And is there one, right? This becomes really important in not only understanding the person, but the creation of eventually your treatment program. Okay, so in the next section, in the microsystem, groups that have direct contact, family, school, parents, Now, the other thing is you have to know a little bit and learn about like these people, because anxious parents create anxious kids. Parents who are picky eaters create kids who are picky eaters, right? In my own family, this is how prevalent this is and how individualized it is. In my own family, I have a niece that when they were young, my sister used to bring her kids to her mother-in-law. And because she was working, and this was before there was daycare and in the summer and stuff like that. Well, I mean, as an adult, my niece was a very intelligent individual, used to be terrified whenever she would hear a siren, a police siren, fire siren, fire truck, anything like that. Well, it was learned after she ended up kind of having to do some desensitization work, is that when they were very young and the grandmother, they would be at the grandmother's, whenever there was a siren, because they lived close to downtown, is the grandmother would take them and run on the stairs and hide in a closet. Well, obviously, there was something to be feared, right? She didn't know, she's 3. But whatever the grandmother was experiencing, it's gotta be true, right? So this fear was not hers. A lot of anxiety doesn't belong to the individual who experiences it. It's learned and it's acquired and it's almost secondhand, right? Is that because it wasn't their experience? And it's interesting in when this process was going through and having to do, then you learn about, because you guys with psych background know about desensitization and some of the strategies, but especially with anxiety, is like questioning the belief system. Where did it come from? That if people are, okay, because did anybody believe in Santa Claus when they were kids? Why? Think about it. Why did you believe in Santa Claus? Is everybody? Who's everybody? Not everybody.
Well, family.
Who in your family?
Parents. Well,
Probably your parents.
when they were younger, yeah.
They tell you that there's a Santa Claus.
You do the whole thing, like I do it
That's
myself.
right. They tell you,
So
yeah.
they get like, yeah, Santa Claus is coming, and look at the snow, and
Yeah.
you do the whole thing. You do the carrot.
So as a parent, you tell your kids there's a Santa Claus, right? And then there's gifts under the tree. So it's true, right? That what you have told them is true. They believe you because it gets reinforced by the fact that there's presents under the tree. Kids absolutely trust what their parents say. But guess what? When it's not positive, you're a loser, you're gone to nothing. There's a lot of really angry, nasty, where our self-esteem, what we believe about ourselves, what we believe about our world around us, our first teachers, the people we trust the most, are the adults in our life. And if they have positive things to say about us and there's positive experiences, we end up with maybe, like that whole saying, children learn what they live. The children learn with fear, right? Then they become anxious. So it's when you start understanding these things that kids' belief systems about themselves, it comes from something as simple like the believing in the Easter Bunny and Christmas and Santa Claus, because even though that's a really, really far-fetched kind of thing, but how much trust is put in that? Even if they oh no, other kids at school say, no, it's not true, and they go, yes, it is. And they fight and they get upset because their parents told them this was truth. And so, but their parents give them messages other than that they're not positive. That's why you need to know who's in here and what they believe. And if I've got anxious kids, and if I've got kids with compromised self-esteem, and if I've got kids that don't know how to problem solve, I'm looking at where that originated. I'm not judging it, I just have to know where it came from and how far back, yeah.
And usually that's why family, the sexual abuse comes from a member in the family. Not the whole time, but it's common that
Quite
it comes
common,
from
most common.
family.
Yeah.
Because they told this what they see and what they are like admiring and like what they believe.
And once that happens, trust. It's just, even if, and if they tell someone they're not believed, but it's just that violation of trust That goes way back, like that's deep seated. And until it's brought to some level of consciousness about how critical that breach of trust is, and that's what happens, and I don't know if I said it last week, but forgive me if I did, is that when relationships end, if someone has stepped outside the relationship and been unfaithful, right? People move on, like we're not, unlike what country music says, that we're gonna fall apart, we're gonna die. No, we don't, right? It's like, we eventually get back on our feet and we realize that it's time to go fishing because there's lots more out there or whatever, and we got ourselves back. Once we've gotten over our own damaged self-esteem, we realize that one of the biggest damages, the collateral damage of someone stepping out of the relationship or having an affair, has to do, it's the person's ability to trust. That's what's lost, and you can't get that back. You can never be, your first love, the very first person that you fell in love with, that silly naivety that you had that was gonna last forever, and you were sure I loved, because you were 14 or 15 or 16 or whatever, and maybe you still love that kind of person. I mean, my husband cheated on me, I still love that guy. What a stupid thing is that, right? Is because that naivety from way back then, I did really love that guy, right? I mean, that behavior had a, whatever, and a whole bunch of other stuff happened, but the ability to trust another person, that's the tragedy in all of this kind of thing, right? And so if you're a person that's raised in a relationship where there's anger and there's bitterness towards the other, well, what you've done is you've kind of raised your kids with those beliefs, and I've seen that, and it's like, why are you disrespecting the father of your children? Why are you disrespecting the mother of your children? Unless there's some kind of abuse or negative stuff, that you don't get a right, like, they get to make their own decision about that. That's my thinking anyway. But it's like when there's an imposition of adults' belief on something, you have to find out what it is, because how we see things is how we operate on the world. Our perception of the world, that's CBT, right? How we think about something creates our emotion that results in our behavior. Like, it's a very simple concept, but until I can know how someone perceives their world, until I know who's in their world, until I know what they've experienced, I can't change how they feel about anything, and then I can't change their behavior. It's a very simple concept, very difficult in the field, right? So I've got, this is what's in somebody's world all the time, on a daily basis, the people that are affecting them, the bully at school. I could ask each of you, who is your worst teacher? I'm not asking, but can you go back and you can remember that experience in school?
Yeah, there was a guy, like a sir, in my 10th grade, who was very partial towards the kids who go to tuition to his house, and he would, grade them more, and he won't grade us.
There you go. That's really suspicious.
Yeah.
Did anybody hear that, what I just heard?
Yeah.
Was there any accusations ever made of anything?
Not outside,
Okay.
then I got pissed, really, then I spoke in front of him, like I got really angry, then I yelled at him, what is going on, like you want the whole class to come to the house with you, then I went and complained to the coordinator.
You're very brave. Yeah, there's a couple of things I've learned. See, that when I'm listening to you, I don't know you, and yet you present like you're very quiet and very shy. It's like, but don't mess with you. Like, I mean, and you have this strong moral backbone. It's like when something's wrong,
Yeah.
like you fight for stuff, right?
Yeah, I do.
You're an advocate. It's like, have you ever thought of being a lawyer?
Yeah.
Yeah. Is it, you just have
I
that.
either wanted to take medicine or lawyers.
Yeah, I can see you being, you just have that way, but it's, when something's right, it's right, and when it's wrong kind of thing, okay, yeah. But that's going back to grade 10, and it's just, that experience, and you just think, I'm freaking captive. Like, do you remember your worst teacher?
This is kind of a common thing back in India where teachers are a bit partial towards students who go to tuition to their home.
Okay.
So this is kind of common.
Okay, so same kind of, okay, so if you belong to a certain class, or you belong to a certain group that will bow or whatever the hell you have to do,
Yeah.
kiss someone's ass or whatever it is, sort of, I don't mean to be disrespectful, but, I mean, that it's different, right, the experience is different, okay.
Yeah.
Worst
my
teacher,
Math teacher in my like junior year. Yeah, it was like, I mean, he was a very smart one, like he knew a lot.
yeah,
But he did what he did to you. He was like super offensive, like all the time. If you couldn't do something, he just yell and like make it so humiliated. It was horrible. Like I just felt horrible. Like you in class, you were like, nope. Like he said, like who wants to participate? But you were trying to hide because it was just horrible.
this is when people don't wanna talk, they use their phone.
Exactly.
You ever see that in an elevator, everybody brings up the phone?
Yes.
Math teachers are being cursed today.
Math teachers, I know.
What's wrong with them?
That's the main reason I didn't want to take math in my 11th and
Exactly.
12th. Yeah, you know.
And that is awesome.
Till 8th grade, I love math because my dad is a chemical engineer, so he used
Oh my
to
God,
teach
you got
me-
your brain going that way anyway, okay?
So he used to teach me a lot, and I used to get good grades. But I think math in 10th, what I faced then,
Yeah.
I lost my interest in math, and 11th and 12th I dropped, and I took pure science. That's it.
You lost your interest not in math, but how it was taught.
Yeah.
But you still love math, but no, for you, it was math.
Now I'm
And-
completely out of touch.
That's right, and yet that still gift is there, the left. Who was your worst teacher?
Back in college, actually, like when I was doing my BA, there was this one teacher who used to say a lot of controversial things, and so like I wouldn't laugh at her jokes and
Good for you, that takes a lot of courage.
yeah, and then yeah, so she would grade me like really less, and there was a lot of times that my friend and I we would work on our assignments together, and so like we were ideating together. We have a similar style of writing, but still my assignments were graded like a lot worse. So yeah, that really distressed me. So at one point I did go and talk to her about it.
Positive results?
Kinda, yeah.
Yeah. Your worst teacher?
Like,
Dual credit, right? Dual credit, you correct us.
yeah, no. This is like grade 1 or something like that.
Yeah.
I had this teacher, and I don't think she's a teacher anymore, but she was very like, this one kid used to swear and she would like roll me around, basically nosebleed once. It was, I don't know, was that teacher?
I'm terrified. I'm terrified. And you? It's like, right? But when you think about it, yeah, especially when it's elementary, if you don't know what's going on in a person's life, and I'm asking you this, it's like you didn't hate math, right? But the experience, and if you don't know what someone's experience was, because that shapes their belief systems, that shapes who they are, and they're captive. That's every day. For kids in school, why you need to know what their experience was. 6 hours a day, 5 days of the week, 10 months of the year, they're stuck in there. And they don't necessarily, they have no power, they have no control kind of thing, right? And so that's what you need to, and you find out about someone's background, what their experience was like at school, especially kids with ADHD, how they were misunderstood, especially anybody who's 40 and up, or even 35 and up, that no one understood it, because they didn't even know what the hell it is, right? They're only beginning to understand a little bit more now. So their impression of themselves, so it's, you get that, you have to know what that is, right? And so that's the microsystem. Now, the mesosystem is interesting. The mesosystem is the relationship of people within the microsystem. Do your parents get along? Are there warring parents? Was there divorce or separation? It's interesting because if there's divorces and then parents remarry and then they become a blended family and then they expect the kids to get along, it's like, I didn't choose them. You're supposed to get along with your, and it's like, I don't like them.
Right.
Well, you married him, I didn't marry them, right? And I don't even like them. And like, but there's just this assumption, just because the adults choose a partner, that somehow the kids are supposed to like each other. That doesn't happen necessarily, right?
Sometimes you don't even like your own siblings.
Yeah, and not even your stepson, your own, you're having a hard time.
Absolutely.
And so, it's funny how that happens. It even happened with my own kids during COVID. It's like, oh my God.
Yeah.
Discussions, polarized views, it was crazy. I raised these people differently to be open-minded, but when it came to certain things, who knows, okay? But then it's the interrelationship and how well the teacher gets along with the parents. If parents come from the belief system, it's the teacher's job to teach kids. It's like, I'm not doing this homework with them, and then the teachers are sitting in the teacher's lounge at school going, ooh, she never works with her kids, you know? And so depending on their relationship, and it's not, if a parent goes in and storms in and says, how come you're not teaching my kid this, and is really aggressive, like who pays the consequence for that? 100% the kid.
And he'll repeat that again, like.
Well, I mean,
Trust
you know,
the
and the-
teacher.
Yeah.
It will be hard, like, to the teacher, because that's what they see, they think that's all right.
And see, and this, it sounds so simple, eh? It sounds so simple, but this is like learned behavior. And then until you can't start anything until you start knowing what you're working with and sort of unraveling all this kind of stuff. So the microsystem is this, and then the mesosystem is actually the relationships that people have. Because when you have positive relationships with people and you know how to communicate, and you can use the language of assertion, and you can question ideas and not the person, when you can attack the idea and not attack the person, it makes a big difference in terms of someone's ability to problem solve, and depending on the skills of people in the mesosystem and their relationship it impacts. Now, the next one is the exosystem. Now, this is important too, because this is your support system. You can look up Bronfenbrenner yourself, or I can post some of the stuff I did in some of your work, but it's easier when you draw a picture, because in this one is they don't have direct relationships with kids, but everything that happens in this system impacts, okay? So if in an exosystem, like an example would be parents' employment. A parent's employment, if the parent works Monday to Friday, well, you have to come late to school. Because you have a responsibility, right? It was you to bring your child. Sorry, it's not you. You have to bring your child to school.
Yeah.
So that's your priority. So if your work, and if you leave here, and if you've got 2 kids at home and you've got to go to school, plus you're working, and the kids have to have babysitters, and then you're having to have extra money. So that makes a difference. What happens, how much someone gets paid, and the job they do directly impacts kids. If someone gets paid $150,000 a year versus someone who gets paid $37,000 a year, like an ECE or a DSW, right? Is that if they have to work 2 jobs, if there's a lot of people, this government policies are part of this. Like if OSAP, if funding bodies, if bands. If all of a sudden the federal government didn't give money to bands anymore for education, there would be a lot of Aboriginal students who wouldn't be going to school anymore, right? If people were not funded by other funding bodies, they wouldn't be here. If there was no such thing as OSAP, students couldn't be, half the college wouldn't even be here. If there wasn't some kind of way of borrowing money to go to school and then paying it back after, there wouldn't be education. So depending on what's happening as far as that's concerned, the benefits packages, if you, wherever your parents work or wherever you work, you have what's called an employee assistance program. Do you have dental? Do you have optical? Because you know what, a lot of times kids, they don't see a dentist because they can't afford, like, I mean, there's some things that are free, but then you get to a certain age. And then if they need glasses, they're only gonna be able to get certain kinds of glasses. And so it's very, which affects their self-esteem. It's very interesting when you start looking at those things outside and how they impact. And then the macro system is the cultural belief systems. How inclusive is someone in a community? Like how inclusive, like you look at Cambrian in terms of the cultural community that we have here, and in terms of inclusiveness, right? But if you have other institutions may not feel, well, you dealt with that, right? You dealt with that at home, and if you weren't part of those kids that went to the professor's home or the teacher's home, that you were excluded, right? So that's sort of that cultural belief system is that I don't know whether it was an economic issue, whether it was, what was the issue? Like it was just that it's just the way?
It is the way.
Oh, okay. So when we look at that, one of the ways of getting information, you sit there and you make a circle with someone. It's that simple, right? And then you find from profit and you get this information. And then you see the world through, what did they live? This is how you gain information about their past. But as I gained information and I asked you about stuff, I also learned about this. I also learned something about you as an individual, that you're feisty and you're very resilient. It's like, do that. Then the other thing we have to think about is, and you can look this up yourself, the other assessment that we do is Maslow. Anybody remember Maslow? Could you do that? Do you want to talk about it, or do you remember? Okay, you know.
Yeah, so he says there's a hierarchy of needs.
Yeah.
And once your basic needs are met, that is when you can begin to fulfill your other needs. So, like as you move forward, your more complex needs are able to be met.
This is really important. Maslow's really important in our work. And I think it's always good if you kind of look it up and research it on your own too. This is the safety. I'll just do this. This is the love and belonging. This is self-esteem. And this is self-actualization. Maybe Mother Teresa might have been this. She may have been self-actualized. So when you look at what Maslow what he suggested is that, and this rings true in our field, right? Is if someone at the first level, we are primates, we are primal beings, right? And we are driven by our need for survival. We are driven by our need for our breathing, food, water, sex, sleep. Like if one of these things is not working, our body's off. Now, from an Aboriginal perspective, they have the medicine wheel. I don't know if anybody's seen that, the social, emotional, spiritual, and cultural. When one part of physical, emotional, mental, and spiritual, when one of those four dimensions is off in our life, we're not walking with balance. Okay? But so in the field of mental health and addiction, I want you to think of Tent City. Remember downtown, Tent City? People living in tents, people living homeless. When you read Gabor Mate, he works with all the people in the Hastings district that are living on the streets of east side of Vancouver. What they're experiencing is homelessness. Like what you said, there's no routine, they have no food, they have no shelter. Their whole life is, what am I gonna do, is existence, right? So we're driven, what Maslow is suggesting is we're driven by our physiological needs, right? If these are not met, we cannot move into this one, right? And the safety needs is our security body of employment, of resources. In order to move up and self-actualize and be the person we want to be, we first of all, the first thing Maslow was suggesting is we have to have these primal needs met. We can't be looking around but worrying about what I'm going to eat today or where I'm going to sleep tonight. This is where you'll work with a lot of street youth. You've worked with street youth at Sassy, right? They're couch surfers. They have no home. They don't know that you can't talk to them about what they're going to be doing for next semester in school. They don't even know what they're doing tonight. They don't know where they're sleeping tonight. They don't know what they're eating tonight, right? And so it's important when you're looking at the psychological, the physiological, and then the next level, we have to have a sense of safety. In order for me to move up and be a productive member of society, I have to have a safe place to live. I have to be in a safe relationship. I have to have some sense of security. I have to have financial security. I have to have employment security. Then I can relax. I can actually plan and do something with my life. That this is what Maslow was suggesting, right? Is that then if I'm not worrying about survival, because these are like survival kinds of things that are going on here, then I can think about love and belonging. This is important for me to feel fulfilled, that I can have a relationship with someone because I'm not worrying that someone's going to screw me over. I've got security, I've got a home, I can raise my family, I've got to, and I can have friendships. And then when I reach past that, I can go, because of all these things happening, I have my physiological needs met, I have safety and security met, I don't have to worry about things. I now have a sense, I feel good about myself, I'm in a loving relationship. Now I can move on to self-esteem, and I can feel a sense of confidence and achievement, because look at all that I've done, right? And then this is the ultimate, whether anybody ever reaches that, is about that you operate almost totally as a moral human being. You do the right thing because it's the right thing to do. That integrity is the way you walk every day. That's the highest compliment anybody can ever pay you. But for the work that you're choosing, in the field of mental health and addictions, you can't talk to someone about what they're feeling good about themselves. Is like you have to find out backwards with their strengths and abilities. You can't talk about planning about the future if they don't even know where they're sleeping tonight. Like, this is when you start your treatment plan, and this becomes really important. You take care of first things first. There was a young kid, I remember, he was brought into a group home that I was working with when I was a social worker in a group home. And he had actually been, he had taken off from home. His parents had called the cops to bring him in because he actually had stolen a tent and had a big fight. He was in the bush, he was living in the bush for about 3 days or something like that. When they brought him into the group home that we had on Elm Street, the cops had his hands tied behind his back. He looked dirty, he looked like he'd been out in the bush kind of thing. And finally I said, can you just take the cuffs off? I mean, the kid was about 6 feet. You could just tell the gentleness. I work from Energies. I don't know if other people work from Energies, and you kind of had to get a sense of someone that way. Anyway, and the first thing I asked him was, do you want something to eat? I'm not going to talk to him about taking off or doing the admission criteria, and all that kind of stuff. You start where they're at. And this is what our field does. You start where someone is at that minute. And it's like, are you hungry? He would start, that kid inhaled. He didn't even stop to chew. He inhaled like an entire meal. And it's like, now that this is done, you want to have a shower? You want to put on some clean clothes? And this is the wonderful thing, when you study about people in history, and that people that have influenced you, I would have to say my readings on Mother Teresa are ones that have had great impact on me, because she was like this high. She was so small, and she was a powerhouse, because she was passionate about taking care of the poorest of the poor, right? And everything about her was like, she's not worried about whether you're a Catholic or not, or whether you believe, or whether she didn't care. It's like, I'm going to take you, I'm going to feed you, I'm going to clothe you. When you were hungry, I fed you. When you were naked, I clothed you. When you were hungry, I fed you. Like, she believed, she didn't talk that talk, she walked the walk, right? And is that in our field, is that we take care of things first. And so self-actualized people are these incredible people that tend to, like someone like Gandhi, he cleaned toilets. His wife was ticked off at him, but she didn't want to do that. But I mean, he actually did what he asked other people to do. Have you ever had a boss in your life where you've worked that does the same work you do? That if you have to clean toilets, they clean toilets too? Like, it's interesting that when someone has, that they don't elevate themselves in your presence, but they are just, so you think of people in your life that walk with integrity and honesty. That's the greatest compliment anybody can ever pay you. Because you say what you mean what you say, and you do what you said you were going to do. Nothing's worse. Anybody can make you promises. Promises. it's following through. That's why for all the years I've ever worked with kids and people, I've never written a contract. Cynthia did contracts, right? I never wrote a contract. If your word is not worth anything, then neither is a sheet of paper that it's written on, right? And that's why a lot of arguments with people, and it really only, when you have marriage license and stuff like that, that's actually a legal document for taking care of things after things don't work. It's actually how the law in terms of property and kids and stuff like that. But in terms of someone's commitment to each other, the paper's not doing it. Your words aren't doing it, nothing else is doing it. Okay, so you would look at people from that perspective. But there's two other ways of amassing information about someone. If you're going to be doing your initial assessment, getting information about them in the social realm of the biopsychosocial. And that's a genogram. Has anybody ever seen a genogram? Okay, this is a really very compressed idea. Because when you do social histories on people, and I actually sit with people and I'm doing social histories, you can't write down as fast as they talk. But in genograms, there's this system of using these symbols, right? And they're universal. They're understood as being symbols. So this is the paternal side. That's the male side. And this is always the maternal side of a genogram. So usually a genogram will go back 3 generations. And that becomes important to understand behavioral patterns, parenting patterns, medical issues, that kind of thing. Okay, so over here, you would have, does anybody have 3 generations going back here? Do you have 3 generations? Okay. On your dad's side, what do you call your grandfather? No, Papa. Okay, Papa. Ma mère?
Yeah.
Okay. On your mom's side? Okay, that's not French. Oh, Papa, okay. Okay. This is not French. Is it Mimi? Are these French on both sides?
Yeah.
Okay. What do you call your grandmother? Okay, and on this side? They're not French. No. So you would call them on this side grandma, and what do you call your grandma? Grandma, okay. If on this side someone was to say Oma and Opa, if they call their grandparents Oma and Opa, that tells me that they've got some Dutch or German in their background. Depending on what you call your grandparents. What do you call your,
That's from Spanish,
from Spanish?
yeah,
Abuela?
yeah,
Abuelo and abuela?
yeah.
Okay. As soon as you tell me that, you don't have to tell me anything. I'm gonna ask you what do you call your grandparents? And I know you have Spanish, right? And I know, and it's not Portuguese, it's Spanish.
Right.
It's different. So abuela, and you have a tío and tía,
Yes.
right? And so when you talk about that, and then it's ma tante, mon oncle, right? And everybody's ma tante, right? And then, so what language do you speak?
I speak Tamil at home.
Okay,
It's an Indian regional language.
yes. So what do you call your grandparents?
We call Tata and Amma.
Tata and Mama? Same thing for you? No?
No, Oma and Abba. So I don't speak company, but that's a background.
Okay, so even interesting, so different regions of India.
Yeah.
So that's interesting too, that it's not just, like if this is cultural for you, that all people who speak Spanish will go abuelo and abuela. We're talking regional differences now,
Yeah.
right? So when you're if you were to go back and do your work at home, and you ask this question, it would be very different depending on their answers. You would know which region of the country that they're from. Oh, that's interesting. Wow, okay, I just learned something.
Because who's it Tata? Who's it Tata? My son his dad is from Chile, and his grandpa wanted to call him Tata, so he's been Tata forever. And he said Abba, right? And he used it from another grandmother, so like they always call her Abba, but we don't know why, and we don't know, but it was years ago.
Yeah,
So that
where it
was
came from.
funny.
It's interesting, because my grandson, his dad is from Chile.
Yeah, so
Yes. Okay, so see how informative this is. First of all, that tells you about culture. That's gonna tell you about practices. Now it tells me different regions in India, which I didn't know about until I just asked, right? And that stuff is very informative. So, and then it tells how someone, if it's a Jewish name, if it's an Italian name, oh, you better be going. You better be going to Sunday dinner, or, you're in big trouble, right? Depending on whether you're first generation, second generation. Because some of that stuff gets further removed, the further you are away from the source of the cultural experience. People, and as there's more intermarriages, cultures, practices change over time, right? Okay, so this is what would happen. This is yours. Okay. So your grandparents on your dad's side had how many kids?
3.
Okay. Who's the oldest? Okay. So then I would write that in, okay? If by chance this person is deceased, I would do that. And I would put the dates, date of birth, date of death, okay? And the reason being that becomes significant when we actually do the timeline. So you have, so your dad's name is so-and-so, so-and-so, okay. Now, your dad, and on your mom's side, how many were there? The oldest is always on the outside. Your mom? Okay. Who's female?
Oh, yeah, she's the youngest, and her older brother.
Oh, it's an older brother.
Yeah.
So you know, as soon as I say a square, it's a brother,
Okay.
right? And so what happens is then you start, this is how, as someone's talking to you, I do this every time. I do this every day when I meet someone for the first time. I take this person and I draw a line over to this person. These people are married, right? And I put the date, and then the date, are they still together? Okay, if they weren't, the date of separation, the date of divorce.
Do you book miscarriages and babies that are like?
Yes, really important. This is what's so amazing about these particular tools, is that they house everything, right? They're symbols, if you were to actually, you would have, this is a whole field of study, right? Is that if there was mental health issues with this person, you would create a legend. And over here, it doesn't matter, as long as you have your own legend, is that this symbol would mean mental health, this symbol, if it's lines going, this would mean addiction. It doesn't matter, as long as you create the legend, and then it corresponds here. You know that there was addictions, or that there was heart issues or health issues. This is where you can trace diabetes, this is where you can trace, and if there's genetic kinds of stuff going on in the family. So you start understanding this, and if this person, and then this union together produced how many?
2.
Who's the oldest?
My older brother, and then me.
Okay. Now, along with this genogram, there's lines that you would put in the legend. For relationships that are really close, who are you really close to? Okay, so this line, I would draw this. It doesn't matter that somebody else doesn't understand it, I do. This is my way of recording history, right? So you're very close, but I didn't hear your mom. And this is how it gets real personal, right? When you start talking, because there's different levels of relationship. There can be a closeness, but it's kind of strained, right? So if that was the case, I would write this, and to the mom, I don't know, I'm sorry, I'm just stepping on things here. And if I do this, then it's like, this is telling me it's kind of strained. But I need to know that. If you're struggling with something, guess what I'm going to? Where's my support? Where's your support system? Yeah, but I've also done a mental math line with, right? I've also done this. I've also got your small circle. I've I've also got this. I also find out that you play hockey. I also find out that you're a team player. I've also found out that you've got friends over here. And so these are my support systems. Now, it's interesting because this even goes on and on and on, right? And it becomes important because if there's remarriages, right? Is that, or previous marriages, or if your uncle's married, then this is your aunt, and then, because always the woman is on the right-hand side, or the partner's on the right-hand side, then they have this, and then this and this, and you can tell me, these are all your cousins. Now I have, but you can't tell me that over here. What does that tell me? I'm really close to this side of the family, and sometimes people don't talk to this side of the family, you know, because something happened years ago, and they got the house, or they did something after a grandparent died, or some nasty thing happened, and they don't talk to that side of the family anymore. And so it's informative in terms of where you go from here, in terms of looking for the support systems, right? And you, even if you're working with a young person, if I was working with you, and you're living at home with your parents, then my identified family, if I'm doing this, it would be, and your brother still lives at home? Yeah. Okay, my identified family I would draw as this. So I know who my family unit is. So it's just ways, I'm just introducing to you, and it's something you may want to look at as you develop your own studies about learning a way instead of, see, because everything here would have dates and ages, would be very specific. Because if you look, when I used to work in group homes and CIS workers would do their social histories, it's like 10 pages of black and white. And like you're trying to recover information from there and writing it all down, but this is a living document. This is what I love about this. When you have this on someone, you start this and do it with pencil, and you keep adding and adding as they tell you stuff, and then you keep getting a bigger picture of who this person is, right? And if there's health-related issues, and then if you talk about the fact that this person was in the war, right, that he was a soldier, and so that you've got maybe some trauma. I had a father-in-law who was choking his wife almost every night. He was in World War II, but he lived trauma every night, right? And what he did in terms of when he would discipline, like my ex-husband, like he was very aggressive, but that was his nature. Like he lived in that time, right? And so you don't judge it, you just want to know it, because it helps you inform and understand. So this is what a genogram is called. That's creating this, understanding their social context, not just Bronfenbrenner, not just Maslow, but you're also looking at doing a genogram. But there's another thing. Oh, we lost it, because and this is the simplest of all tools. And it also informs social context. It's this. Called the timeline. You were born here. This is who we're at right now. This is 2022, September 14th. I'm sitting with you, September 14th, 2022. You were born, oh, it's your birthday. Okay. What year? 2000. 2000. Six. So, and then you were 1, 2, 3, 4, 5. How old are you now? You were 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12. I actually do this, guys. 13, 14, 15, 16, 17, 18, 19, 20, 21, and you're okay, so you're 22. Okay. Yes. You fill in simple things like this. Tell me where you went to school. Three, where? In grade 4?
Same thing. Like,
Okay,
same school all the way up to about grade 3.
9? Okay, same Joseph. Same school?
Yeah.
They knew you, it was regular, it was you. Then what happened? When you were 3. Okay, so you're 1, 2, 3, 4, 5, 6, 7. Okay. This is JK? JK, SK, grade 1, grade 2. Oh, no, you're 7. Like- No, you're 7 in grade 1, right?
Yeah.
Okay, so you are 9. Okay, grade 3. So this is grade 3. What happened?
Then I went to private school
Why?
because I only went up to grade 3.
Okay, where did you go?
St. Highs,
To what grade?
to grade 8.
3. You were grade 4, grade 5, grade 6, grade 7, grade 8. Grade 8, you were 14. St. Eyes. Did everybody go?
Yeah.
Okay. Then where did you go?
After that, again, stuff like very downtown high school.
Where?
At his own.
So 14, 15, 16, okay. Okay, and then you can,
And then I went to university for 4 years after that.
and now you're here.
Yeah.
Okay, okay. You look at this. There was not a lot of stability. No. Ah. So I know that you stayed at the same school. Now, what happens when kids have to change schools and different friends, that's hard. But, okay, I'm not gonna ask too many personal things.
it's all good.
But what happens is that when events happen here, when grandparents die, you record deaths here. You start, not only do you have them up here, but you start recording pertinent information down here, right? This is when, so you would have the miscarriage reported over here, but you would have the miscarriage reported down here as well, is that mom, or that a brother was born or a sister was born, because that changes the dynamics of the family, right? Or if there was a divorce, if there was a separation, when there was an introduction of a new partner, mom, and I do this with people all the time, because what it does, it tells you, this is the living document. This is the one that tells you what happened. And you keep going back and you get triggered by events. Is that a young person I worked with, the last recollection of her father was when she was 6. I'm seeing her, she's 18, right? In my private work. We go back and we do a timeline, and what happened? Oh, this is when my dad died. How did he die? And then, so she tells me her interpretation of how he died. And she takes ownership for it. She thinks somehow, you're 6, you believe in Santa Claus, you've got magical thinking. She thinks something she did or said, and this is the truth, guys, I'm telling you the truth, caused her father's death. She's 18. She still believes this, right? Because that's what she's never been challenged on, that thought process. But because of that, she then was put on some medication that ended up at a very young age that she shouldn't have been on, caused some kind of suicidal ideation. They think that so this girl at 10 attempts to kill herself. So I got this done. No, she didn't. That was not a suicide attempt. You find out the information that she was placed on an antidepressant, counterindicated for anyone under the age of 16. And for anybody going on any kind of antidepressant for the first 6 weeks, you're highly susceptible to suicidal ideation and suicidal behavior. And especially when you're 10 and someone puts you on that. That was not a suicide attempt, but she was treated like that. So anyway, she's got this idea that she started having some hallucinations, which when, interesting enough, was unresolved trauma. And finally at 18, when we're finally sitting there, we were able to challenge. She didn't know. Her recollection, she was with her dad, she thinks what she did, the next day her dad wasn't there and her dad died. What she didn't know, because you're 6, is that your dad had cancer. And that no one told you that because you're 6.
right? But now you understand when you look back, isn't it, oh, now you understand things. You shift the, that's so critical. This whole thing about CBT and then learning about someone's perception, because their perception has created their emotional state. Their emotional state has resulted in their behavior. I'm useless, I'm terrible, I did this terrible thing in my life. I feel so guilty about it, I can't carry the guilt. You know, I'm feeling so crappy about myself. I feel terrible, I feel guilty, I feel this. I can't deal with it anymore, it's too painful. I have to get rid of the feelings. I'm gonna stay stoned every day. It's so much easier. It's so much easier, because as soon as I'm conscious again, as soon as I'm sober, right? I mean, it's not that simple, but it is that simple. It's not that complicated, but it is that complicated, right? And learning, so it's like when you do this and you get this idea of, and you get a timeline, and you're gathering information, and it stays there. It never goes away. And you keep working, because as soon as, have you ever been around a family gathering and someone starts talking about something, you go, oh yeah, I remember it. Oh yeah, I remember this. That's what happens. This is like a triggering kind of assessment tool, because you're always assessing. And when you're talking about resilience, through this whole thing, as someone's telling me what they've lived, and there's a lot that you've lived, a lot that we haven't put on here. Yes. And you know how I know that? Because I'm looking at you. I saw your face. Is that it's with all due respect, it's like we communicate, 80% of our communication is nonverbal. Everybody here is exhausted. I know that. I have to end the class because of how I'm looking at everybody right now. Is that I'm reading body language, but I also read you. And it's how you learn to do that. Is that this is not the place or the time, but I triggered memories for you. And I took you back to certain things. It's like, yeah, but that's what we do in the work that we do, right? And so it becomes a living kind of, and then you see strengths. They don't even know when they don't even know how strong they are. When they've had to make, these kids that have had 3, 4, 5, 6 school changes and made all these adaptations, no wonder you don't have friends. You've learned that everybody in life is temporary. Is that you're not gonna take the risk. Not that you don't want to, it's like you've learned, like, what's the point? Like army brats, right? It's like, why am I gonna do that? Because I'm gonna move in a year or 2 from now. But it also talks about how resilient someone is, that when you can do all those things, where you've lived through certain events and you're a survivor of some kind of abuse, and yet you still move on and you still do stuff. Like you're a living example of that, right? Your resilience personified is that what you do is like, until you look at it, you don't appreciate it yourself. You see it in everybody else, how awesome they are, but you don't acknowledge it in yourself. And the people that we're working with, they don't see it because they self-deprecate. They see themselves as, like, they see the life that they're living and they don't want to be it. I've sat with so many people like this. And this is not what they want to do. They don't know how, and they honestly don't know how. Right? So, anyway, these are all your assessment tools. This is a biopsychosocial model. We sort of threw it in the cultural when we had the America pair, the cultural kinds of differences. In the spiritual, we've addressed that to some extent, being born Catholic, so you feel guilty about everything. So it's just, and we'll keep going back and forth these things. Any questions about this?
The last one is, what is it, spiritual, and the other one?
Cultural.
Okay.
I can't even read my own writing sometimes, so yeah, let's go, yeah. Okay. Anybody that's attending by Zoom, do you have any questions? You have to ask me, I can't read that far away.
No, thank you.
No, okay. Hi. I don't see people in person. So thank you for attending. I'm going to be uploading this anyway because there's just like tons of information. But Chimigwech, by the way, that is Aboriginal. That is Ojibwe. Miigwech is thank you. In Ojibwe, Chimigwech is thank you very much. And the ha is no big deal. So there's just little kinds of. So if I say Miigwech or Chimigwech, it's I've had this opportunity to learn about the first world view of the Aboriginal culture. I don't know much about the language, but so that's what that is. All right, enjoy your class this afternoon. Go home and have a nice rest.
It was a good session.
Oh, thank you.
Thank you, teacher.
Thank you.
Thank you. Thank you, Professor. Bye.
Okay, take care. Text me if you have any questions.
Yeah, sure.
Email me, email me.
Take care.
Be good, Maureen.
Okay.